Hi everyone, this is Dr. John Shia. Today we are going to look at tolerance and autoimmune disease. Tolerance is a specific immunological unresponsiveness. In general, antigens that are present during embryonic life are considered self and do not stimulate an immunological response. Clonal deletion is the removal of self-reactive B and T cells that have expressed receptors for self before they develop into fully immunocompetent lymphocytes. We call this clonal deletion a negative selection or central tolerance, which occurs in the thymus. Medullary thymic epithelial cells display a vast collection of self-proteins to guide this deletion process. Clonal deletion prevents B and T lymphocytes from reacting against own cells. Thus, it helps protect individuals against autoimmunity. In this example, there are two types of immature T cells, reactive T cell A and non-reactive T cell B. T cell A is responsive to the embryonic self-antigen. Thus, this self-reactive T cell is programmed for clonal deletion, undergoing apoptosis. On the other hand, T cell B is not responsive to any of the self-antigens. Thus, it survives the clonal selection process. Some of the self-reactive T cells are not killed in the thymus, as not all types of self-antigens are expressed by medullary thymic epithelial cells. They escape the clonal deletion process. Therefore, peripheral tolerance is necessary to block the expression of self-reactive T cells. Three mechanisms are involved in peripheral tolerance. Firstly, energy. Self-reactive T cell fails to be activated due to the absence of B7 co-stimulatory molecule. These energetic T cells, however, can become functional and initiate an autoimmune disease if the condition changes later in life. Secondly, peripheral tolerance is achieved through suppression. Regulatory T cell secretes inhibitory cytokines. And thirdly, through another round of clonal deletion, part of these self-reactive T cells are killed via apoptosis. Clonal ignorance refers to those self-reactive T cells that ignore self-antigens. These self-reactive T cells are kept ignorant either by firstly, inaccessibility to sequestered antigens in immunoprivileged organs due to a physical barrier, such as fetus, testis, and the blood-brain barrier. Or secondly, self-reactive T cells ignore self-antigens as they are present in such a small amount. B cells will also become tolerant to self by two mechanisms. Firstly, clonal deletion. While self-reactive B cell precursors are still in the bone marrow, or by clonal energy, while the self-reactive B cells are in the periphery. It is noteworthy to mention that tolerance in B cells is less complete than in T cells, as most autoimmune diseases are mediated by antibodies. Under certain circumstances, tolerance to B cells and T cells may be terminated. For example, a cross-reacting antigen tends to terminate tolerance. Antibody against streptococci can cross-react with cardiac myosin, as in rheumatic fever. Secondly, administration of immunosuppressive drugs enhances tolerance, especially in post-organ transplant patients. tolerance is best maintained if the antigen to which the immune system is tolerant continues to be present. Next, we shall move on to autoimmunity. The adult host usually exhibits tolerance towards self-antigens since fetal life. However, in certain circumstances, tolerance may be lost and immune reactions against self-antigens reactivated, resulting in autoimmune diseases. There are three main predisposing factors of autoimmune diseases. Many autoimmune diseases exhibit a marked familial incidence, which suggests a genetic predisposition to these disorders. There is a strong association of some diseases with human leukocyte antigen specificities, especially the class II genes. For example, rheumatoid arthritis occurs predominantly in individuals carrying HLA-DR4 gene. Another risk factor of immune disease is hormonal factor. Approximately 90% of all autoimmune diseases occur in women. Although the explanation for this markedly unequal gender ratio is unclear, there is some evidence from animal models suggesting that estrogen can alter the B-cell repertoire, hence enhance the formation of antibody against DNA. Clinically, it is observed that systemic lupus erythematosus either appears or exacerbates during pregnancy or immediately postpartum. This supports the idea that hormones play an important role in predisposing women to an autoimmune disease. There are several environmental agents that trigger autoimmune diseases, most of which are either bacteria or viruses. For example, pharyngitis caused by Streptococcus pyogenes predisposes to rheumatic fever, affecting the cardiac myosin. Coxsackie virus infection in mice causes type 1 diabetes but have not been established as a cause in humans. Procainamide, an antiarrhythmic drug, causes systemic lupus erythematosus. Heavy metals such as gold and mercury causes autoimmune diseases in experimental animals. Ladies and gentlemen, you must be curious why suddenly the tolerance against self-antigen is lost and the antibody starts to attack our own cells. There are 5 mechanisms of autoimmunity. The first mechanism is molecular mimicry. When an environment trigger, either microbes or drugs, highly resembles a component of the host body, an immune attack is then initiated against that body component. For instance, M protein of Streptococcus pyogenes mimics the cardiac myosin. Antibodies against M protein cross-react with cardiac myosin, leading to rheumatic heart disease. Rheumatic heart disease is a condition in which the heart valves have been permanently damaged by rheumatic fever. Secondly, alteration of normal protein. Drugs can bind to normal proteins and make them immunogenic. For instance, procainamide may induce systemic lupus erythematosus in susceptible individuals. Other drugs such as hydralazine, quinidine, isoniazid may induce lupus erythematosus as well. Next is by release of sequestered antigen. Certain tissues such as sperm, central nervous system, the lens, and the uveal tract of the eye are sequestered so that their antigens are not exposed to the immune system. These tissues are located at immunoprivileged sites. When such antigens enter the circulation accidentally, they elicit immune responses, leading to conditions such as spermatogenesis, encephalitis, and endothelmitis, respectively. The fourth mechanism is by epitope spreading. Epitope is part of an antigen molecule to which an antibody attaches to. Epitope spreading refers to the development of an immune response to epitopes distinct from and non-cross-reactive with the disease-causing epitope. On the right side of the slide, yellow small triangles and green rectangles represent the sequestered autoantigens released by the damaged host cells as a result of persistent microbial infection. Both microbial and self-antigens are processed by the antigen-presenting cell under the influence of epitope spreading. Bystander self-reactive T cells are activated against self-antigens, while T cells for microbials continue to produce antibody against the microbes. The immune system now attacks both microbial and host antigen. Regulatory T cells or Treg produces interleukin-10, which inhibits pro-inflammatory T helper 1 cell. Treg is characterized as CD4 positive, CD25 positive, and FOXP3 positive. If Treg fails, then autoimmune diseases may develop. Autoimmune diseases are those in which the body is attacked by its own specific adaptive immune response. In normal, healthy states, the immune system induces tolerance, which is a lack of anti-self immune response. However, with autoimmunity, there is a loss of immune tolerance, and the mechanisms responsible for autoimmune diseases include type 2, 3, and 4 hypersensitivity reactions. Autoimmune diseases can have a variety of mixed symptoms that flare up and disappear, making diagnosis difficult. This table shows that autoimmune diseases may either attack the receptors or cell components using antibody. Alternatively, it can attack own cells via cell-mediated immunity. Next, we shall look at some examples on autoimmune diseases. Allergic encephalitis. During preparation of rabies vaccine, rabies virus is grown in a rabbit brain cell culture, which also contains rabbit myelin protein. In individuals injected with this vaccine preparation, host immune response will react on both the rabies viral antigen and the rabbit myelin protein. The antibody produced against the rabbit myelin protein cross-reacts with human myelin, leading to inflammation of the human brain. This is due to molecular mimicry. Allergic encephalitis may also occur following measles or influenza infection, but they are rare. In multiple sclerosis, self-reactive T cells and activated macrophages cause demyelination of white matter of the brain. Epstein-Barr virus is thought to be the trigger. Multiple sclerosis affects the brain and the spinal cord. Symptoms include blurred vision, loss of sensation, limb weakness, bladder dysfunction, tingling, and numbness. Immunosuppressive drugs such as prednisolone and methotrexate can relieve these symptoms and delay disease progression. Hashimoto thyroiditis is also known as chronic lymphocytic thyroiditis, in which thyroid gland is gradually destroyed. Self-reactive or autoreactive T cells are produced against thyroglobulin. Thyroid glands are enlarged and form a painless goiter and eventually developed into fibrosis. Next is idiopathic thrombocytopenia purpura. It is caused by autoantibodies directed against platelets. The antibody platelet complexes are then destroyed by macrophage in the spleen or by membrane attack complex. A decrease in platelets causes easy bruising, bleeding gums, and internal bleeding. Heptin, such as penicillin and cephalosporin, binds to the red blood cell and forms a neoantigen that induces immune response. This causes lysis of red blood cell, leading to hemolytic anemia. In type 1 diabetes, it is believed that viruses infect the beta islet cells. Antibody generated destroys both the virus and the infected beta cells. Thus, very little or no insulin is produced. Besides genetic and obesity, surprisingly, type 2 diabetes is also an autoimmune disease. Autoantibodies attack insulin receptors, in which these interferes with insulin binding. Cells in muscle, fat, and liver become resistant to insulin. Because these cells do not interact in a normal way with insulin, they don't take in enough sugar. Thus, the pancreas is unable to produce enough insulin to manage blood sugar level. Myasthenia gravis is a chronic autoimmune neuromuscular disease that causes weakness in the skeletal muscles. It worsens after periods of activity and improves after periods of rest. Autoantibodies attack acetylcholine receptors at neuromuscular junctions. In this case, it affects the muscle of upper eyelid. Graves' disease is an immune disorder that results in the overproduction of thyroid hormones. Common symptoms include unintended weight loss, an abnormal intolerance of heat, muscle weakness, fatigue, and bulging of the eyeballs from their sockets. Circulating autoantibodies bind to the thyrotropin receptor to mimic thyrotropin, stimulating thyroid to produce more thyroxine. Excessive thyroxine causes goiter. Inflammatory bowel disease is a term for two conditions, Crohn's disease and ulcerative colitis, that are characterized by chronic inflammation of the gastrointestinal tract, manifested by diarrhea, often bloody, with crampy lower abdominal pain. It is thought that chronic inflammation is caused by an abnormal immune response towards the normal flora of the bowel. Crohn's disease can affect any part of the GI tract from the mouth to the anus, whereas ulcerative colitis occurs in the colon and in the rectum. Damaged areas appear in patches that are next to the areas of healthy tissue in Crohn's disease, while in ulcerative colitis, damaged areas are continuous, usually starting at the rectum and spreading further into colon. Next, we will see some diseases involving multiple organs or systemic autoimmune diseases. Systemic lupus erythematosus is the most common type of lupus. SLE is an autoimmune disease in which the immune system attacks its own tissues, causing widespread inflammation and tissue damage in the affected organs. It can affect the joints, skin, brain, lungs, kidneys, and blood vessels. The characteristic butterfly rash on the cheeks is as a result of vasculitis caused by immune complex deposition. Glomerulonephritis are due to the deposition of immune complexes and C3 complement protein. SLE affects primarily women between the age of 20 to 60 years old. Individuals with HLA, DR2 or DR3 genes are especially susceptible to SLE. Autoantibodies are formed mainly against DNA and histones. SLE is also drug-induced. Procainamide and hydralazine are known to cause SLE. Sjogren syndrome or dry eye, dry mouth syndrome. This syndrome is caused by infiltration of lymphocytes in the exocrine organs. The typical symptoms would be dry eye and dry mouth.
Rheumatoid arthritis is a common autoimmune disorder of the joints that affects about 1% of the population worldwide, more often women than men. The exact causes of the disease are unknown, but an individual's risk is thought to be increased by a combination of genetic and environmental factors. Many of the genes associated with rheumatoid arthritis are involved in immune system function. Non-genetic risk factors include age, diet, infectious agents, and smoking. In an autoimmune disorder such as rheumatoid arthritis, the immune system mistakenly attacks and destroys the body's own cells and tissues, which immunologists refer to as self. And this autoimmunity can begin many years before joint symptoms are noticed. Doctors can use blood tests to identify this preclinical phase by the presence of multiple factors in the blood, such as autoantibodies and inflammatory factors. These early autoantibodies are thought to first develop outside of the joints, possibly in the gut, mouth, or lungs. Environmental factors such as smoking can modify our self-proteins, making them targets for the immune system. One particular modification is called citrullination. When the immune system recognizes these modified self-proteins, it leads to a breach of self-tolerance and the production of autoreactive B cells and autoantibodies, and later autoreactive T cells, the hallmarks of autoimmune disease. By the time that symptoms appear, the immune response has intensified and the antibodies produced target a broader range of self-proteins. But it's only in some patients that this systemic autoimmunity progresses to joint inflammation, which is possibly triggered by an increase in joint permeability and increased access to antibodies. Working out how to prevent this progression is a major goal for scientists. In patients who do develop joint disease, the small joints of the hands and feet are most commonly affected. After entering a joint, immune cells and autoantibodies bind to modified self-proteins in the cartilage, bone and lining of the joint called the synovium. This induces an inflammatory response and activates cells in the joint such as macrophages, neutrophils and osteoclasts, as well as blood monocytes. Activated monocytes differentiate into yet more macrophages, which together with other cells in the joint produce soluble inflammatory factors known as cytokines. Drugs targeting these cytokines are highly effective treatments for many patients. Left unchecked, however, damage caused by the inflammatory environment can expose new self-antigens to the immune system, continuing the cycle. At this stage, the first clinical symptoms of joint pain, swelling and warmth appear. Some patients recover, but most commonly, patients develop a chronic destructive disorder. As the disease progresses, dendritic cells display the newly exposed self-antigens and activate T cells in the joint itself or in the local lymph node. In addition, B cells infiltrate the joint, where they proliferate and produce antibodies and other factors, further amplifying the autoimmune response. Cells in the joint lining, called fibroblast-like synoviocytes, also proliferate and grow into the joint space, spreading across to the cartilage surface. These cells secrete matrix-degrading enzymes which erode the cartilage tissue. Bone is also eroded as osteoclasts, which contribute to normal bone turnover, become hyperactivated. Bone erosion, cartilage destruction and joint swelling cause severe pain, restrict movement of the joint, and in the worst cases can cause joint deformities. And as well as the joints, other organs and body systems can be affected by the ongoing inflammation. For example, inflammation in the blood vessels can lead to heart disease. So early and aggressive therapy is recommended to prevent these systemic complications. By further understanding the immune markers and mechanisms of rheumatoid arthritis, it's hoped that targeted interventions could ultimately change the course of the disease.
With this, I thank you very much for your kind attention.